Surge in telehealth weight loss prescriptions sparks medical concerns in Australia. In recent years, the landscape of healthcare has undergone a digital transformation, and nowhere is this more evident than in the rise of telehealth services. Australians seeking fast and convenient access to weight loss drugs are increasingly turning to online platforms. A simple process, filling out a questionnaire, uploading a few photos, and taking a call from a doctor, is often all that is required to secure a prescription. However, this rapid growth in telehealth prescribing is triggering alarm bells among health professionals who worry that the trend may be doing more harm than good. A booming industry. The demand for weight loss medication in Australia has soared in the wake of the global popularity of drugs such as Ozempic and Wegovy, injectables originally designed to treat type 2 diabetes but now widely known for their weight loss side effects. Telehealth companies have seized this opportunity by offering streamlined, user-friendly processes for obtaining these medications without requiring in-person medical consultations. Companies like Juniper, Pilot, and Eucalyptus have become household names, using targeted online advertising and social media campaigns to reach tens of thousands of Australians. Their websites typically promise fast assessments, discreet service, and regular delivery, all appealing features for individuals seeking a quick fix to a complex issue. Yet the simplicity and speed of this model are raising red flags in the medical community. Too easy to get. Dr. Amanda Roberts, an endocrinologist based in Sydney, believes the ease of accessing these medications through telehealth platforms is deeply concerning. We are now in a situation where people with very minimal oversight or medical history are being prescribed potent drugs. These medications were never intended to be used so casually, she said. She added that without face-to-face assessments, critical physical checks and in-depth lifestyle evaluations are being skipped. Obesity is a chronic disease, but it's also a symptom of a range of medical and psychological issues, said Dr. Roberts. You can't treat it effectively with a 5-minute online form. Prescription for profit. The rise of direct-to-consumer telehealth has also raised ethical questions about whether business interests are overriding clinical judgment. Critics argue that the business models of many of these telehealth firms depend on subscriptions and repeat prescriptions, creating a financial incentive to keep customers medicated for longer periods than necessary. A recent report by the Australian Medical Association (AMA) called for tighter regulation of online prescription services, citing risks including misdiagnosis, drug dependency, and even potential medication abuse. "We're not saying telehealth is bad," said AMA President Professor Steve Robson. "It has been a game changer, especially during the COVID-19 pandemic. But when it comes to prescribing Schedule IV medications like semaglutide, Ozempic, we must ensure patients are getting proper care, not just convenience." Regulatory gaps. Currently, the Therapeutic Goods Administration (TGA) regulates medications in Australia, but it does not directly oversee how telehealth companies deliver their services. Meanwhile, the Australian Health Practitioner Regulation Agency (AHPRA) monitors registered medical professionals, but not the platforms themselves. This fragmented oversight has left a regulatory gray area that some companies appear to be exploiting. In May 2025, the TGA issued a warning to healthcare providers about the risks of overprescribing GLP-1 receptor agonists, the class of drugs including Ozempic, highlighting growing concerns around off-label use and potential side effects like pancreatitis, gallstones, and thyroid tumors. Despite this, online prescription services continue to flourish, with social media influencers and celebrities further fueling demand. Patient experience. A mixed bag. For some patients, telehealth has been a lifesaver. Natalie Andrews, a 36-year-old from Melbourne, described her experience with an online weight loss program as the first thing that actually worked. "I've struggled with my weight for years. I've tried gyms, meal plans, therapy, you name it," she said. "Getting Ozempic through a telehealth service was fast and easy. I've lost 14 kilos in 6 months and feel more confident than ever." But others have reported side effects and frustration. John Taylor, 42, from Brisbane, was prescribed a weight loss drug online despite having a history of heart disease. I filled out the form, had a short Zoom call, and got the medication within a week, he said. 2 months later, I ended up in hospital with high blood pressure and chest pain. My GP was shocked I was even prescribed it. Such stories highlight the risks associated with bypassing traditional medical oversight. The mental health factor. Psychologists are also warning that online weight loss prescriptions could exacerbate body image issues, particularly among young adults. Dr. Sarah Lynn, a psychologist specializing in eating disorders, noted that making weight loss medication so accessible could send the wrong message, that weight loss is the most important measure of health. She warned that such messaging might fuel disordered eating patterns and poor self-esteem, especially in vulnerable populations. What's next? Calls for reform are growing louder. Several state health ministers have signaled their intention to push for a national review of telehealth prescription services. Among the proposed measures are mandatory face-to-face consultation before prescribing Schedule IV medications, more robust patient history checks, independent audits of telehealth companies, mandatory reporting of prescription data to Medicare. The Federal Department of Health has acknowledged the concerns and said it is closely monitoring the issue. Conclusion. The expansion of telehealth services has brought undeniable benefits, from improving access to rural care to offering more flexible appointment times. But when it comes to prescribing powerful weight loss drugs, experts warn that convenience should not come at the cost of patient safety. Until clearer regulations are introduced, the responsibility remains largely with patients to weigh the benefits and risks, and with healthcare professionals to speak up when they believe care is being compromised in the name of speed and profit. Hashtags. Hashtag telehealth Australia, hashtag weight loss drugs, hashtag Ozempic, hashtag Wegovy, hashtag health regulation, hashtag digital health, hashtag medical ethics.